Someone who's been a tremendous support for us in last year, 2020, was Erin Smith, and she joins us again for the brand new year. Erin, welcome back to The Informer.
Oh, George, thank you for having me.
I trust the year pans out the way you wanted to, because there are so many things at play. And I want to look at the mental health and issue that's been affecting so many people over the past year or so. And I want to know what we can do to support our volunteer emergency service workers who have gone above and beyond in really disruptive times. What can we do to help them and make their lives and their jobs a little bit easier?
Well, gee, I wish I had a simple answer for you. I think it's a complex interplay of things that we need to be doing to provide really good support for the mental health of our volunteers, George, because we know they are the backbone of our disaster response, particularly when it comes to things like the catastrophic bushfires that we saw back this time last year. And without those volunteers, we can't mount the effective response that we do. But we know that these people, they're not paid professionals. They're teachers, they're nurses, they're accountants, they're bakers. And then at the end of their 10-day shift, sometimes 12-hour days, they go back and have to go back to their normal job to make ends meet. And they don't really get the time to decompress and deal with potentially what they've seen. And most of these people are working within communities that they live in, that they work in, that their friends and family are part of. So the potential mental health impact is quite profound. And yeah, I just don't think we're quite doing enough yet to really support their mental health when the bushfire season is over.
I was just going to say, you're talking about the bushfire season, but there was a double whammy this year. They were called upon on a number of occasions to come to the party and to assist. And it's amazing to think that 12 months on, we've got a new bushfire season almost upon us, and there are still things that we need to address, we need to attend to. Why is it, you think, that the state and the federal governments are struggling to do what needs to be done and to provide the sort of investment that will provide some answers and some support?
Yeah, you're absolutely right, George. We certainly saw the impact of last year's bushfires compounded by the profound mental health toll of the pandemic as well. And I think we sort of jumped from lauding our bushfire heroes, the firefighters, and we saw them in their uniforms, and people were shouting them coffees and free lunches and thinking that they were the heroes. And then the pandemic hit, and all of a sudden we were lauding the healthcare professionals, and quite rightly, because they were putting themselves on the front line. But I think in terms of the response and the support that's been provided, from the many volunteers that I've spoken to over the past couple of months, what they're telling me is that no one actually came and spoke to us. No one actually came and asked us, what do you need? It's all well and good for state and federal governments to say they're putting all this money and funding, which is fantastic, into supporting mental health. But if it's not going to the right places, then it's not going to do the right job. And so many people that I've spoken to said, yeah, well, it's fine that they're saying telehealth is available, but if I don't even have a laptop, how am I meant to access that? And if I'm in an area where I've lost my home and I'm still living in a shipping container, the last thing I can think about is trying to find access to electronic mental health support. So I think the first step is really going into these impacted communities, seeing what they need, asking what they need, and starting from there, rather than telling them this is the support we're offering.
Those images that you've just invoked for us are mind-numbing. I can't believe that, as you say, state and federal governments are throwing money and they're doing this and the other. But we've been told by medical professionals throughout all of last year, if you can provide one-to-one or face-to-face support, that is way more beneficial than doing things remotely. So why aren't we getting people out there? Why aren't we getting professionals who know their craft, who know their job, and who know what these young men and women and people of all ages who are working on those front lines to support them? What don't we get, Erin? What's the missing link?
Yeah. Look, I think there are a couple of issues at play here, George. Obviously, the pandemic has thrown things into disarray, and where we usually probably would have been able to send people into local communities because of the pandemic, social distancing, restrictions on travel, that's made it quite logistically difficult. And also, I mean, we don't want to underplay the role that telehealth has played. That's a huge step forward, and it's been fantastic in so many other people being able to reach out and utilise. But one thing I know we spoke about last time I chatted with you was the real need to not only ask people to reach out for help, but to encourage them to reach in. And if that help isn't there in their local communities, it's a lot harder for me to call up a employee assistance line or some stranger at the end of a line and chat to them than it is to go and sit down face to face, like you said, with someone in my local community. But there's also challenges with that as well, because what we've found in some of these local communities is there might only be one local psychologist or mental health professional, and the people there might not be comfortable going to have a chat with them and bearing their soul, because maybe it's their mate's wife or their sister's cousin or something like that. No. And they're not as comfortable in opening up to somebody that they know. So we need to be just mindful of those smaller regional areas.
As always, whenever I ask you something, you have this amazing capacity to cut through and give us an idea of just how many challenges and how many layers of challenge exist. Okay, if there was one thing we could do ASAP, right? We don't want to see our frontline heroes, whether the bushfires or COVID, kicked to the curb when the danger has passed. We want to be there for them just as they are for us. What would you like to see done first?
I think for me, George, what I've seen and what I've heard speaking to so many responders, both in Victoria and New South Wales, who responded to Black Summer last year, it's starting with their organisations. And it's the little things in just being recognised and being heard. And it was amazing that the overwhelming majority of people that I've spoken to, particularly in New South Wales and, as I said, here in Victoria, said that their organisation never reached out to them to say, are you okay? They may have received a generic bulk email that said, if you need to talk to someone, here's the number for the Employee Assistance Program. But they were all like, well, that's rubbish. Like, I put my life on the line. Some of these people lost their homes, and then they had to back up. They didn't have sick leave or work cover or anything because they weren't paid professionals. They still had to go and work. And then they didn't even get a single phone call or anyone touching base to say, hey, we know you've had a really rough trot. Are you okay? Is there anything that you need? Now, that's something quite simple that every emergency service organisation can do, whether they're paid responders or volunteers, is to just reach into your staff and make sure they're doing okay.
Well done, well said, and on the money as always. Erin Smith joining us on The Informer. Thank you very much, Erin. Look forward to catching up with you again. And to you and your family, I hope it's a strong and very positive 2021.
Thank you, George, likewise.
All the best.